Hi guys, this is Alex from Salmonella Place, and today I'm going to give you a lecture on diabetes mellitus. So what is diabetes mellitus and what causes it? This is a pancreatic disorder, and in order to understand this disorder, you must first know some basic facts about insulin. This is a hormone and it is created in the beta cells of the pancreas. And when released, its function is to allow the body's cells to absorb glucose from the bloodstream and to either store it or use it as energy. There are two types of diabetes mellitus that occur with two completely different pathomechanisms. Type 1 is when there are insufficient insulin levels in the bloodstream due to the lack of production in the pancreas, and type 2 is when there are sufficient amounts of insulin both in the bloodstream and being produced in the pancreas. However, the body's cells have become resistant to its effects. There are also two sets of predisposing factors for diabetes mellitus, rather than a single clear cause for each. Type 1 diabetes is possibly due to viruses and exposure to environmental toxins. The other factor is that some patients may have a genetic tendency towards this particular disorder. Some studies also claim that this disease is caused by an autoimmune mechanism. It has an earlier onset in life compared to the second type. Type 2 diabetes mellitus is thought to be caused by being overweight or having a BMI, that's a body mass index, that is classed as obese. Also, having a genetic tendency towards the disease, having an unstable blood sugar level, enduring high stress levels for an extended period of time, and being exposed to environmental toxins. What are the symptoms of diabetes mellitus? Excessive urination or polyuria, constant thirst, known as polydipsia, and a dry mouth, also called xerostomia. Weight loss, which is in type 1 of this diabetes mellitus, blurred vision, and tiredness or fatigue. In type 1 patients, ketoacidosis can sometimes occur, and the person in question must seek medical help immediately. The symptoms that can be observed include extreme polyuria and polydipsia, weakness, hyperventilation, nausea, vomiting, and breath that smells like nail varnish remover. Type 2 and type 1 patients can often develop hypoglycemia. It is noticeable due to excessive sweating, tremor, and drowsiness. In this case, the patient should drink a sugary drink and follow it with a high carbohydrate snack. If the patient loses consciousness, an ambulance must be called. Long-term complications include coronary artery disease, peripheral vascular disease, stroke, retinopathy, neuropathy, nephropathy, impotence, and tingling, burning, and numbness of the feet. How is diabetes mellitus diagnosed? There are several methods of blood tests that are used to diagnose diabetes, and they must be repeated at 2 separate intervals to ensure correct diagnosis. For children and adults that aren't pregnant, the most common test is the fasting blood glucose test. There is a fast done by the patient for 8 hours overnight, and in the morning, without consuming anything, the patient has their blood glucose levels tested after giving blood. A diagnosis of diabetes is formed if a blood glucose level of 126 milligrams per deciliter or higher is present after an 8-hour fast. Pregnant women, however, undergo the oral glucose tolerance test. Gestational diabetes, which is temporary diabetes during pregnancy, is present when a blood glucose level of 200 milligrams per deciliter or higher is found after 2 hours after drinking a beverage containing 75 grams of glucose dissolved in water. I would just like to note that not all women who are pregnant will get gestational diabetes, and the predisposing factors are the same as those mentioned previously. So what is the treatment for diabetes mellitus? The treatment plan that is initiated and altered according to a patient's needs is very individual. In the case of diabetes, doctors who only support the idea of conventional medicine freely admit that drugs are not enough to prevent the deterioration of a patient, and that the only way to get a diabetic patients' health under control is to help them understand that a serious lifestyle change is in order and to encourage them to see it through. The primary treatment protocol is to regularly monitor the patient's blood sugar for the patient to make the necessary dietary changes, and in some cases, insulin is prescribed for type 1 diabetics, as well as oral antidiabetics, which are given to both type 1 and type 2 patients. For those who are extremely motivated to save their health, fish oil, vitamins, and minerals are recommended, as well as regular exercises. More alternative treatments include acupuncture, mind-body therapies, homeopathy, massage, and avoiding environmental toxins such as chemicals and processed foods.